I just wanted to start by welcoming everyone. We're so excited to have you all join us here in the Chartis Health Collective Village. I'm Dr. Portia Newman, the Associate Vice President and Associate Partner here at the firm. And primarily my role is really focused on education and engagement. So today's discussion is so fitting to the work that I do on a day-to-day. Our unique community for health equity, diversity, and inclusion innovators and change agents provides access to specialized content, case studies, events, and resources for leaders in health and in healthcare. We're happy to have you all here with us. We hope that you brought your questions, and we look forward to engaging with each of you. Of course, if you have any questions about the village, or if you want to learn more about hosting an event, or if you're interested in inviting a client or a colleague, you can always reach out to me. I'll make sure my email address gets put in the chat. And I'll also, welcome any emails or thoughts at the close of today's program. So let's get started. Our discussion today, entitled What's Possible? Board Leaders and Health Equity Outcomes, is one that I'm really excited about, and particularly because I'm joined by Dr. Derrick Mitchell, who's also a consultant here with Chartis. How are you doing today, Derrick?
I am doing well. And you?
I'm doing well, okay? It's Wednesday. It's a good day. It's a good day. So let me start by telling folks a little bit about you. You all, Dr. Derrick Mitchell is, as I mentioned, a consultant here with Chartis Health Collective. He's worked in the healthcare field for about 20 years. He holds both the project management professional and agile practitioner certifications from the Project Management Institute, and has also obtained his certificate in diversity management in healthcare from the American Hospital Association. Dr. Derrick Mitchell obtained a BA in biology from Grinnell College and a master's in health services administration for National Louis University, and recently completed his doctorate in healthcare administration at the Medical University of South Carolina. His doctoral project, entitled Hospital Board Composition Effects on Health Equity, focused on evaluating the correlation between board diversity and the strategic prioritization of health equity strategies. I'm excited to be in this conversation with Dr. Derrick today for a number of reasons. But before we get started, Dr. Derrick, is there anything you want to add to your introduction?
No, that was great. Thank you so much.
Wonderful. Well, let's get started. So to begin today's conversation, I thought it might be appropriate for us to start by acknowledging your personal research around board diversity. Can you talk to us a little bit about your research?
Yeah, absolutely. So as you can tell from my intro, I'm very, very interested in healthcare leadership, and truly looking at it from a diversity and inclusion perspective. So for my doctoral project, I wanted to focus it on determining, is there a correlation between the demographic makeup of a hospital board and the strategic priorities that they set towards health equity within their hospital. So to do this, I utilized two surveys from the American Hospital Association, which they it was used to collect questions from their member hospitals that were focused on board diversity, health equity initiatives, and how they prioritize key strategies. So now these surveys were done across all of their 4,000 members, but I focused this research only on for-profit and not-for-profits here in the state of Illinois, where I'm from. So let me tell you about these two surveys. So the first survey was their 2020 board governance survey, and from that survey, I was able to determine the sex of the board, a male or female, their race and ethnicity, their age, and also how long they have served on that board. And then also I was able to utilize the 2021 annual survey, which gave insights on the hospital's 2020 and 2022 strategic initiatives. And from this survey, I was able to focus on 9 health equity strategies that they were asked to rate and prioritize to focus on. Are they focusing on these strategies within their organization around food insecurity, housing, transportation and other social drivers of health. And so they were able to rate and select, are they doing anything between one or all 9 of them. Finally, using the U.S. Census data, I calculated the diversity makeup of each board. So I compared the diversity of the board of white versus male versus female and white versus non-white to the surrounding communities that they serve using the U.S. Census. And from that makeup, I was able to determine if a board was considered high, medium, or low diversity. Okay. So after synthesizing all of this data, getting all of this insights, I was able to, the results showed that boards that were shown as high or medium diversity, meaning that if their board was had a representation of the community that they served within a medium or high status based off of my algorithm, they were more strategic in prioritizing their health equity initiatives. So let me tell you how what that meant. So boards that were high or medium diversity were focused on 2 to 3 initiatives within that 2-year period of 2020 to 2022. And boards that were of low diversity were focused on an average anywhere between 7 or all 9 of the initiatives. So that's what the outcome of my paper was. And just to level set, when I did this paper, it was not done to say I already know what the hypothesis is, right? I merely wanted to see if I put in this index of what is the diversity of the board and what initiatives do they focus on, what does that correlation tell me? And so this was the outcome, and then from that outcome, I was able to come up with conclusions, summaries, and think about next steps.
Yeah, that's good. And we will likely talk about those next steps. That's helpful. One of the things that I wanted to underscore what I'm hearing you in terms of the data analysis that you did, right? So previously collected data, was that you were really focused on the board's diversity. And I think that this is a hot topic across hospital systems, across healthcare organizations, as really thinking about their people diversity and not just race and ethnicity, but also thinking about gender, sexual orientation, lived experience, because we recognize that those identifiers plus others, right, help us understand the communities that are being served. They also has implications for like who we're recruiting to be on the board, and how what you're getting at is how it ultimately informs the decision making or the strategic planning actions associated with those boards. So I appreciate you sharing just some background insight into the work that you've been doing over the last 2 or 3 years, if not
3.5 to 4 years, yeah.
4 years, yeah. So you've been in it. And one of the things that I think is really powerful about the academic side of this work is like, how do we apply it, right? And that's where I want to spend a bulk of our conversation today, is like, of the insights and ideas and data that you've collected, how does that inform how we think about board makeup? And of course, ultimately, how does that impact those decisions and strategic direction? So one of the kind of follow-up questions that I have for you is really about how does your work specifically help contribute to the larger body of work or knowledge around board strategy?
Yeah. So what I would say is that that's a great question. And I would say that the results of this study, they were informative because it provided that key insight to say that there is a correlation between a demographically diverse board and prioritizing their strategies. And so what I was able to infer through this process is that by being diverse, the study implies that you in turn bring diverse perspectives and therefore are able to be more strategic in your key decision making as a group. Now, further knowledge will be needed, right, to kind of talk about what does that mean. But on a foundational level, these results can show that if an organization is I'm struggling with resources, or saying I'm funding, or is I'm limited on staffing, having a prioritized approach to addressing the needs of your community will be imperative. And from this data, from this research, it was able to give a foundational understanding to show that when a group of individuals on a particular group or board were diverse, their ability to make strategic decisions and prioritize from a group of 9 were able to unilaterally across all of the medium and high diverse boards, even without knowing what each of the other were doing. They were to say, hey, we don't need to focus on all 7, all 9. Let's focus on these 2 to 3 strategic initiatives for this 2 to 3 year period so that we can make the most impact for our community. And by prioritizing these key strategies to address areas of disparities, there we can show that there's a unique understanding of the diverse communities that they serve. And it will also allow them to be more strategic in informing the types of strategies that the board should implement across the organization.
Yeah, that's helpful. And one thing that this brings up for me is while we're talking about all of this research is also trying to think a little bit about what other research concerning board strategy, board makeup, board development exist. And I don't know if you are able to do so, but can you talk a little bit about what other insights you gathered? Our research individually is always great, but like what else is in the body of knowledge that helps us really think about how this board work aligns to the work that you've been studying? Any other particular research pieces that come to mind?
Great question, right? I mean, as you know, as an academic, our reference page is probably as long as our paper, right? But I will say there was a study by Harvard Business Review, an article by David Nadler, and I think it was entitled Building Better Boards. And it was really talking about how our boards, what is the engagement of your board within an organization? And so it reviewed the involvement of the board from being a passive board to where you are less involved and you function directly under the direction of the CEO, where you have middle involvement, or called an engaged board, where you can give insights and advice to the CEO around key priorities, all the way over to where you are the most involved board, which is called an operating board, where they can make key decisions and really drive the strategic direction and management implementations alongside the CEO. And so I think when I think about this work, helping boards understand where they sit on this scale will kind of help them shape what kind of impact they can have when they're thinking about the mission, vision, and value that they are developing. And then if they want to go even further and think about strategies that the organization can implement, understanding where the boards sit on that scale based off of this tool by David Nadler could be helpful. So, but here's the thing. I often hear boards say, well, I often hear CEOs say the boards don't have executive oversight on the outcomes of patients. They just sit kind of high level with strategy, thinking about, what is the mission, what is the vision. But I think if the mission and vision of an organization is to deliver on equitable and just patient care, and there are changes that the organization should be doing and strategies that the organization should be doing, and the board is also in tandem responsible for the evaluation and the retention of a CEO, right? If the board is able to set a strategic direction and kind of think about these are the things that we want to do from this level, but also what we want to do within the organization, but also externally within our community, then when they are evaluating that CEO after their 2 or 3 year period, how well did the CEO deliver on that strategic direction across the organization? So while they may not have the management oversight to implement what they can think about as an overall strategy and to truly help the organization think strategically about how to manage external patient care, they do have direct oversight on who is that executive leader that can ensure that trickling down through the organization, these things are happening.
Yeah, you're kind of getting into some valuable points here around who those people are, how they understand their role on a board, right? What's the board's purpose? I'm actually glad you brought up Natalie's piece. It's actually in that book behind me. So that's a really good one. And it's also making me think about just the culture of boards in general, right? So you've got these individuals, often very, smart people who are experts in their kind of roles and responsibilities separate of the organization and are coming together in a team space, right? And what we know about team environments is that they're trying to make some decisions with their own opinions and with the organization in mind. It makes me think about another piece by Jeffrey Sonnenfeld, who states, like, what distinguishes exemplary boards is that they are robust, effective social systems that include having a culture of open dissent. And as I was listening to you talk about your research, right, and trying to get through those 1 through 9 kind of focused areas or objectives as we think about those strategic plans, is that I imagine that there's often some type of conflict, maybe, or difference of opinions and difference that often inform whether or not we make a decision that will impact the bottom line, patient care, increase or decrease in the workforce. So there's like implications for this dynamic on a board that I think goes a long way. I am also thinking, naturally, right, about the work we do here at Chartis, where we get to support board leaders in distinguishing between that role of like governments and the CEO role in leading the operations or management within an organization. And we often talk about that clearly defining those roles allow them to make really effective or develop really effective strategies. One of the things that I think we get a raised hand all the time is like we can say words like diversity and equity and inclusion when we're talking about board work. But I want to just hone in for a second on the word diversity. When you think about what it means when we say board leadership diversity, what are we talking about here? All right, are there any specific ideas or categories? Because I think about diversity in terms of a spectrum, right? There's a number of social identifiers and notations we can keep in mind. But when we think about board leadership diversity, what does that mean to you?
Yeah. So when I think about from a health equity standpoint, and I'm thinking about what does it mean to be a board leader? What does it mean? What does it mean to have diversity of board? How are we determining if your board is diverse? I'm thinking about the idea that it is diversity that indicates that the individuals that are placed on the board have influence, knowledge, and understanding that reflects and represents the communities that they serve. And in particular, the diversity and the unique and diverse demographics of the individuals in the communities that they serve. So, for example, if your hospital sits in a community that serves a subset of the Asian population, it should be imperative that the board has representation of that subset within it. So that same can be said for male and female makeup, sexual orientation, lived experiences. If your board is focused on such things like a mental wellness or a mental health, or if there's a particular mission-driven value that your board is doing, do you have individuals that sit on your board that have a lived experience from that? So I have actually heard a couple of times where people challenge the word diversity and they want to replace it with using the word representation. And so when you think about representation, this could be direct because it could be very targeted to say we have an individual or individuals in which their intersectionality of being male, female, black, white, their sexual orientation, they can be recruited or placed on the board to have a voice or to be a representative of that community. Or it can be indirect to where there are alliances or partnerships with individuals who can provide insight of a given community that has a disparity or lived experience that may not currently sit on the board. So when I'm thinking about that leadership and that ability to represent from a health equity standpoint, right now, I'm just saying, if we're thinking about, if we're going all the way from the board all the way to the community, how are we ensuring that the individuals on that board are equipped with the knowledge, the tools, or the individuals to be able to be a representative sample of the communities that they serve?
Yeah, this screams opportunity, an opportunity for a number of organizations to be more intentional, right, about who those board leaders are, where there might be additional access points or opportunity to create that access point to be board leaders. This brings me to a big question, and I don't even know if we have all the time to talk about this, but I think it's worth bringing up. Is very simply, how do you think about building better boards? What does that look like? And maybe you're thinking about this from a recruitment standpoint. Maybe it's about a community engagement standpoint, but I'd be interested in hearing from you. How do you think we could build better boards?
Yeah, I think that's a great question. And I knew you were going to ask me that question. And so I was already thinking about it earlier as you were going, because I already know how you think now. How do you build better boards? I think the first thing is, so as we talk about it, again, I'm centering this conversation around health equity. So I'm centering around patient facing. So I think the first thing that you really want to do is you have to make sure that you understand who are the individuals in your community. So you can use the U.S. Census, as I did with my paper, or you can segment your patient base using the data that you collect during your patient intake process, right? And then the organization must try to understand, okay, based off of what we've collected, what are the demographic areas that we want to focus on, right? When you think about diversity, when you think about representation, especially as we talk about, there are many facets of how you can slice and segment key areas of a demographic. What demographic is imperative, that has the greatest disparity, greatest need, or has a disparity or has a need in general, that you want to ensure that you have the right individuals on your board that can target those areas. And so you can't do that unless you have the data to be able to determine where those gaps exist. In order to have that data, do you have the proper tools and technology and process in place to collect that data? And then do you have the right education across the organization to help members of the organization understand why it's important to collect that data, how to collect that data, and how we're going to be using this data to be better stewards for our community, right? Because that information goes twofold. It goes from the person taking the data and the person that you are asking for questions that may be sensitive, right? If you ask me about my sexuality, I may not be willing to tell you that, but if it's communicated, if it's embedded in the organizational process, if it's embedded in how we've learned how to ask that question to make people understand why this is important for us and how it will be useful for patients, we collect that information, and now we can say, we know that we have this particular patient base. What are we doing at a board level to ensure that we have that as well? And I think the last piece that I'll add here is that you often hear boards say, well, we don't have the right people. We have identified that we need X, but we don't have anybody in the pipeline that can fit that role on our board, and that's why our board is not diverse. Well, we need to figure out what are ways in which there is education, training, processes, tools, pipeline development, programs, leadership programs. How are we emerging leaders within the organization, internally or externally, so that we can say that we've identified gaps or areas of need on our board, and what are we doing to find ways to close that gap or to train people over a series of time, so that when they are ready, they can be that person for the board. And until then, as I said earlier, how are we partnering key pillars and leaders of the community, key individuals of influence that may or may not sit on the board, but can still give us that insight that we need while we're waiting to find individuals that can actually take a permanent seat on the board.
Mm-hmm. Mm-hmm. That's good. I was thinking as you were talking just about my experience in working with board leaders, board of trustee groups in a number of different capacities, that oftentimes folks don't have a clear direction just yet, right? And I recognize that folks' entry to health equity outcomes often brings up other questions or opportunities, if you will, for both what you're talking about, that learning, that education piece. How do we start to build that foundational knowledge? In our work here at Chartis Health Collective, what I get really excited about is our kind of thought process and focus on really assessing the readiness of the board. And that is, talking about individual persons, right, on the board, but also thinking about what vision do they have? How does it advance with health equity in mind? How does it shift or change with the community in mind? And then I think it actually begs larger questions around the how, how do we actually go about that? And so our work, and I'm kind of paraphrasing what I'm hearing from you, is that it too is also focused on kind of this 3-pillar breakdown, right? What does the assessment look like? How do we gather that information? What's the data that we need in order to understand where the board sits today? It gets back to some of that research you mentioned. Where are the perspectives? Are people ready to shift? Is there an opportunity for change? And then we think about the education piece, which could happen in a number of different ways. And then the sustainability, how do you can continue to do this? And sometimes that looks like, how do you sustain the individuals on the board? How do you continue to build their capacity? While I'm thinking about the connections from how you're thinking about building better boards and the work that we do, what would be your advice? And we don't have to go through a lot of strategies, but what are some of your initial thoughts on what would you share with a board leader or someone who is currently operating on a board as it relates to health equity, but what should they be considering when they're thinking about their board strategy? What are some key kind of pieces to that strategy that come to mind?
Mm-hmm. Yeah, and so some of the stuff you've mentioned, I think, but I'm just gonna lay it out as I kind of think about it in my mind as 1, 2, 3, and 4. So I think the first thing is ensuring that the individuals on the board have a true understanding of the vision, mission, and value of the organization. Mm-hmm. And by understanding what that is, then how are they aligning that with any strategies or principles or guidelines that they want to develop? So if your mission, vision, and value is aligned and it is anchored in health equity, then how are we ensuring that any strategies that we implement, any ways that we're holding the organization accountable, how are we ensuring that it aligns with that overall strategy? So if you are not embedded, if you're not, if that is not ingrained into the core of who you are as a board member, that is our first step. And also the board has to have that set, right? It needs to be clear, it needs to be easily articulated, and it needs to be not just shared and siloed within the board, but how is that information shared across the organization? Mm-hmm. Second, I would say, again, everything that I'm talking about today is just really thinking about how do we get to that health equity focus piece, is understand the disparities that are happening within your community or the communities that you serve. Because if we don't understand what the drivers are that are leading to these health inequities, it will be hard for us to even think about what strategies we want or should put in place that can align with our vision, mission, and values to put together a strategic plan for 2 to 3 years.
Can I add something there? I think that social drivers piece is important, because recognizing that not every hospital space or board in general will have the same drivers present at the same rate in their community. So I think that collection of data there is really powerful, because I think it says very specifically, what is that board up against? What are they should they be thinking about? And then also forecasting, right? As communities shift, change, as the folks in those communities sometimes become transient, right? or there's an emerging population or demographic of people as well. Okay, I'll let you keep going, but I thought that was a good call out.
No. You were just trying to steal my thunder because you talked about the emerging population, and so that's my number 3. It's right. You need to survey and do a demographic analysis of the population that you serve, an analysis of your executive leadership, an analysis of your board, and to see how do they align. So similar to my research, if your population is 50% X, does your board, does your executive leadership, does your management, does it represent the communities that you serve? Because from a strategic level, these individuals will have insight and understanding of the needs of the community from a personal lived experience. And if that is not there and those gaps exist, what are we doing as an organization to address those gaps and to mitigate them? The next thing is, I would say, perform an assessment of the board's foundational knowledge and understanding of the terms diversity, inclusion, belonging, and health equity. What is the board's understanding of these terms? And because you want to ensure that they understand that it is important that there is a foundational knowledge that exists within the board around these terms, because it's going to help us understand why it is imperative that we have diverse perspectives and how those diverse perspectives can be valued and welcomed in the group. It'll seek to eliminate such things as bias and microaggressions and stereotypes as we're working through different disparities that may exist either among the board or among the community, right? Somebody on the board might say, well, this group of people live this way because of this, and it may be a stereotype or a bias that they have. And so having that foundational understanding of how do we understand our conscious and unconscious biases and how may that influence or impact the way that we think about strategy. It'll also build towards a culture of psychological safety. And I think, we talk about this term all the time, but I think it's important because as members of a board, you want to make sure that you have the ability to challenge the status quo, to speak up, to talk about your lived experience, and talk about how your personal diverse perspective may impact decisions that are happening on the board. And so having that foundational level and understanding of what psychological safety is as a board and what the board can do to ensure that is happening would be helpful. And then finally, making that connection for the board around how the internal working of an organization impacts the external workings, right? So how are we taking that internal working of the organization as far as the leadership makeup, the strategies that are implemented, and what impact does that have on the external community? And so having that foundational knowledge and level and understanding around what health equity is from a board level will help them work together to start on the same page, to continue on that journey. And I think the last piece, last but not least, I would say, is what I think I would like to do, what I would like to say to a board is I want to challenge them to think about how they can integrate the work that they do into the external work with patients and communities by building health equity strategies and initiatives into the framework of the pillar of their work. And so multiple initiatives may come up, right? There are all these different things that are happening, as you said, when you think about a community, the community's ebb and flow between who lives in a community, and they can knock down houses of a particular community, and all of a sudden this community looked like this, but after 2 years, when they rebuild houses and they've raised prices, the whole community looks different because a different group of people can't afford to live in that area. So knowing that knowledge of who is in your community, what strategic directive and initiatives will you come up with from a health equity standpoint that you want to address within a 2 to 3 year period? Understanding that you have limited time, limited resources, limited staff, and limited funding. And that is why having that diverse perspective, those diverse lived experiences, those diverse backgrounds, having individuals that you can connect on the board or externally from the board to help shape what are those key pillars, those key strategic health equity focuses that we want to focus on within this next 2 to 3 years from the board. And then having a strategic scorecard that the board uses to monitor and track how the organization is doing, and using that to evaluate, to inform, and to determine how well the CEO is doing in implementing those health equity strategies.
Yeah, you're definitely.
That was a lot. I know. That was a lot.
It was. I was taking notes. You're actually getting to this sustainability piece, how to continue to do this work long term. And I think that's actually really important. I want to also extend to the folks who've joined us today, if there are any questions that you may have, feel free to post those in the chat. If we don't get to all the questions, we'll be able to reserve some time as a follow-up to make sure that we get those answered. But while folks are maybe thinking about some of those questions, one of the things that I wanted to underscore that I did hear you talk a little bit about is the opportunity for board members to kind of engage in their own learning journey, right? So recognizing that folks are coming to their board work from different experiences, different organizations. You did really call out the opportunity to do some education for themselves, like getting clarity on what do we mean by diversity and equity, and then more importantly, what's the accountability attached to those ideas and those concepts. I can't help but underscore kind of what I said earlier about the work that we do, and specifically thinking about it from an assessment phase, which gives us the opportunity to know more. That, I think, part of the work also sometimes presents itself as challenging to organizations because we don't want to see what we're doing wrong. But I like to think of it as a gift, right? It's like the more information we have, the better we can work together, the better we can think about designing strategic plans with health equity in mind and with those outcomes being a critical part of that. And then, of course, the education piece. I would just want to call out that a number of opportunities to engage boards, from my perspective, have also started with education. Hey, we want a training on this. We want to understand a little bit more about inclusive team spaces. We want to understand a little bit more about how we think about community engagement, or how do we start to manage our own biases around the communities that we're in? What can we do better to recruit? All of those things have often started with an education opportunity. And so that is not lost on me, the value of that, but just want to note that that's a part of the process, right? There's more that we can do to create a robust strategic a plan around for boards. And then I called out this earlier, and you said it 1,000 times over, is the sustainability piece. Really thinking about how we translate what folks are learning, what folks are doing, what folks are designing on their boards as a focus to the practical piece, right? What does it look like in terms of implementation? What are the expectations for leaders of that organization to carry out those goals and objectives? And then how do we continue to be in the know? One thing that I love about board service is that I do think there's a level of curiosity that has to exist when you're thinking about getting to know the organization and advancing or growing organization, but also how you get to know yourself in relation to that organization. So thinking about those opportunities to network, build relationships within the community in order to really be able to serve a community thoughtfully. I can say more about how this continues to sets us up for effective outcomes, but let me just make sure I'm not missing any questions in the chat. 1 second. And then I can also underscore that there's some resources in the chat too for folks if they have additional interest in the work that we're able to do here at Chartis Just Health Collective. The other piece before we kind of keep it moving is that I love to just maybe pause for a second and maybe get a brief response from you, Dr. Derrick, and thinking about this board work. We've got resources in the chat, of course, but I guess I'm interested if you were thinking about just overall board diversity, board readiness. We talked about outcomes. We talked about how to really align that board group to the work that you're doing. Is there any one additional piece of advice that you would leave? And I think I asked this question earlier. You gave us some advice for folks who are already on the board. What advice do you have for folks who are aspiring to be on a board, right? So kind of working their way up towards thinking about their participation in board service.
Yeah, I like how you called out this idea of board service, right? So I sit on two different boards, right? And they're not executive leadership hospital health equity focused boards, but they're giving me the understanding of figuring out, how do I work with a team? How do I work with strategy, right? What are ways in which you can be a part of a team that can utilize your ability to strategize, to use your sphere of influence, and build your arsenal around if doing board service is something that is passionate to you, then how are you aligning yourself, or also finding a mentor, or finding a sponsor, somebody that's on the board that can kind of help you in those ways. There are also on the board, there's also sometimes an advisory role or member at large, or there are roles that you can take on the board where you can even be a leader of my brain is making of a group that the board serves. So if a board has a finance group or a group or a strategy group, right? You can be the chair of that group, and that could be a stepping stone for you to move up to a seat on the board. So how can you be in service or of service of the organization to take on that self-learning process for yourself, rather than waiting for others to scope you out for the board?
That's cool. And I guess I'll leave. I don't see any additional questions in the chat, but I think the work that we do with boards is so powerful. There's so much opportunity there. And so if you haven't had the opportunity, please take a look at the resources we provided. But also, I just want to call out that the exciting part of this work, when we start to connect the dots between the people and the practice, and then ultimately see that knowledge kind of transition into action and implementation, just really helps us to see a different shift in board culture and ultimately toward a larger impact. And that's kind of like where I get so excited. So to end our chat today, I want to also offer an opportunity for folks to connect with us, maybe even talk about their future in board service, or the future of the board work that they will continue to do with the organizations that they serve. So we'll make sure our LinkedIn, or my email's already in the chat. And Dr. Derrick, we also look forward to that additional notes and points from your research agenda, if you will, to continue to think about how we leverage that data that's readily available to folks to be able to make really good or build better boards. If there's no other questions from our guests, I also want to make sure I say thank you to you all. Thanks for listening in. If there are things that come up, please let us know. We'd love to chat. And please, if you have any questions about the village, I'd love to engage with you all as well. So thank you so much, Dr. Derrick. We should do this again, maybe at the second phase of your research agenda. But thank you so much.
Awesome. Thank you all so much.